Hi, I'm Dr. Wilson. I'm a PhD molecular biologist, and welcome to another COVID debunking video. Recently, the FDA approved COVID vaccines for children 6 months through 4 years of age, and as a parent, I'm really happy about that because my daughter is extremely likely to encounter SARS-CoV-2 in her lifetime, and when that happens, I want her to have as much protection as possible. But unsurprisingly, anti-vaxxers are not too happy about this. In fact, they're doing what they do best, spreading disinformation on the internet in order to scare parents into not vaccinating their children. The most recent viral video on this topic has been from a Dr. Clare Craig, who is currently getting shared widely on the internet for making wildly inaccurate claims and blatantly lying about the Pfizer clinical trials regarding children 6 months through 4 years of age for COVID vaccines. Now, literally everything that Clare Craig says in her video can be easily debunked and fact-checked just by looking at the FDA briefing document that she claims to be reporting on. But she is banking on her viewers not reading it and instead taking her word for it. I'm not going to let her do that, especially not when the price is putting children at more risk than is necessary. So I'm going to take you through everything that she says and show you exactly where in the document it shows that she is wrong. So let's get started.
There's an awful lot about this trial that has shocked me, and I think will shock you too. The trial recruited 4,526 children aged from 6 months to 4 years old. 3,000 of these children did not make it to the end of the trial. That is a huge number. 2/3 of them. Why was there this drop-off? That needs to be answered.
Well, Claire, it can be answered if you simply read the document. All of the children are accounted for in the clinical trial. It spells this out in tables and in text. All you have to do is read it. Out of the 4,526 children recruited to this trial, only 58 in total dropped out from the trial. This includes a total of 45 participants that withdrew from the 2 to 4 years of age group, 24 in the vaccine group, and 21 in the placebo group, and a total of 13 participants withdrawing from the 6 to 23 months of age group, with 9 withdrawing from the vaccine group and 4 withdrawing from the placebo group. The reasons for each withdrawal are listed plainly in the text. This is not a conspiracy, this is not rocket science, this is simply reading the document that you pretend to be reporting on, Claire. Try it, please.
So what did the trial show? Well, they defined severe COVID as children who had a slightly raised heart rate or a few more breaths per minute. There were 6 children aged 2 to 4 who had severe COVID in the vaccine group, but only 1 in the placebo group. So on that basis, the likelihood that this vaccine is actually causing severe COVID is higher than the likelihood that it isn't.
Yeah, not quite, Claire. You see, if you actually read the document, you will see that there was a narrative written for each case of what they defined as severe COVID. These narratives describe exactly what happened in each case. Let's take a look and see what it says. Of the 7 cases of severe COVID in participants aged 2 to 4 years old, it is true that 6 were found to be in the vaccine group, with 1 being in the placebo group. However, 5 of the 6 cases in the vaccine group met criteria for a severe COVID case based on only 1 criterion, which was either an increased heart rate or an increased respiratory rate. All of these were considered by the investigator as not clinically significant based on examination at the illness visit and contributing circumstances, such as the participant crying during the examination. So a kid was crying and that increased their heart or respiratory rate, and that is what qualified them as a severe COVID case. This is a loose definition, but they had already started the clinical trial and they couldn't change it partway through, so that's what they had to go with. You have to read the details here if you really want to know what happened. The final severe case in the vaccine group was in a 2-year-old who had an increased respiratory rate and decreased oxygen, and was hospitalized. While this child was hospitalized, it was found that they were co-infected with parainfluenza virus 3 and COVID-19. Thankfully, they were discharged from the hospital and made a full recovery. So was this hospitalization caused by either influenza or SARS-CoV-2? For the purposes of this clinical trial, it doesn't matter. They met the criteria for severe COVID, so they were considered a severe COVID case because that's what scientists following their own protocol would do if they're being honest, which they are. Meanwhile, in the 6 months to 23 months age group, there was one kid who was hospitalized with severe COVID and ended up suffering a seizure. They were in the placebo group. It was found that this patient was also co-infected with rhinovirus and enterovirus, but just like the parainfluenza virus co-infection that we saw in the older age group that I just talked about, we have to count this one as a severe COVID case. And for what it's worth, the investigator did think that the fever could be attributed to COVID-19. So overall, there were 3 children who had clinically significant signs of severe COVID in this trial, 1 in the vaccine group and 2 in the placebo groups. And by the way, the enrollment of vaccinated to unvaccinated in this trial was 2 to 1. So the idea that these vaccines are increasing the amount of severe COVID is just bananas, and it goes against all of the other data that we have for every single other age group. So don't trust Claire on this one. Read the document for yourself. Seriously.
There was actually one child who was hospitalized in this trial. They had a fever and a seizure. They had been vaccinated.
Yeah, that's either a complete lie or she hasn't read the document and shouldn't be trying to inform people on the internet. As I just explained, the one hospitalization in the vaccine group did not have a seizure. Meanwhile, there was one hospitalization in the placebo group that did have a tonic-clonic seizure and a febrile seizure. For those who don't know, a febrile seizure is relatively common, is usually harmless, it doesn't leave any lasting damage, and it's usually caused by fevers. Meanwhile, a tonic-clonic seizure is a little more serious. So this situation is what she would really be talking about if she was concerned about children's health, but she's not, instead she's lying.
So now let's turn to what they defined as any COVID. And what they did was to utterly twist the data. They vaccinated the children and they waited 3 weeks after the first dose before the second dose. In that 3-week period, 34 of the vaccinated children got COVID and only 13 in the placebo group, which worked out as a 30% increased chance of catching COVID in that 3-week period if you were vaccinated. So they ignored that data.
Nope, that's another miss for Claire. The numbers are clearly stated in the tables, and again, you have to remember the 2 to 1 enrollment, 2 vaccinated for every 1 unvaccinated in these groups. So in Table 19, where we can see the COVID cases that occurred after dose 1 but before dose 2, and this is to be expected. You're not going to have very much protection against COVID in the first 3 weeks after your first mRNA vaccine. You really need that second dose to start boosting up your immunity. So these results, completely unsurprising.
And then there was an 8-week gap between the second dose and the third dose, where again, children were getting plenty of COVID in the vaccine arm, so they ignored that data.
Again, not ignored. It's literally all listed right there in Table 19.
There was then 7 weeks after the third dose, which they also ignored, which meant that in the end, they had ignored 97% of the COVID that occurred during the trial.
I don't know in what universe you can consider literally putting all of the data into tables and graphs for readers to see is considered ignoring it, but I guess that's the universe that Clare Craig lives in. I don't know.
And they just looked at tiny numbers, so tiny. In the end, they were comparing 3 children in the vaccine arm who had COVID with 7 in the placebo arm. And they said that this showed the vaccine was effective.
No, that's not what made them say that the vaccine was effective, Claire. You literally have to read the first few paragraphs of this document in order to know that. But since you didn't do that, let me do it for you. When it comes to the 3 children who were used to calculate a vaccine efficacy, as Claire says, it's because a preliminary descriptive analysis of vaccine efficacy was going to involve people who received 3 vaccinations. And since the protocol was amended to include 3 doses after unblinding had happened, the number of kids who received 3 doses was small. But in that group, there were a small number of COVID cases, so that's how they calculated a, again, preliminary descriptive analysis of vaccine efficacy. Meanwhile, the primary endpoints of this study was studying immune responses. This is what's referred to as immunobridging. This is when you know what an effective immune response looks like in an older population where the vaccine has been studied and shown to prevent disease. You correlate an immune response to that protection and use that as immunobridging. I want to make it clear that this is not claiming to have established an immune correlate of protection for SARS-CoV-2. This is just looking at what kind of immune response did people have when they were exposed to the vaccine and they developed a protective immune response, and can we replicate that in children? That's all it's looking at. This is not a new approach. This has been done, for example, for HPV vaccines, which prevent HPV, which is traditionally spread sexually among humans. Children, of course, aren't going to be sexually active, so they can't acquire a HPV infection. However, when HPV vaccines were tested in younger children, immunobridging was used to establish the fact that the vaccines were actually working. The alternative here, of course, is to wait and gather more data. But while we wait, that's going to involve more kids getting hospitalized and more kids dying. So we don't do that because we know enough to know that these vaccines are going to protect kids against severe outcomes of COVID. That's what we go with. That's the ethical thing to do, and that's the scientific thing to do.
And all of this on a backdrop of a disease which doesn't affect children.
I am really sick of people saying that COVID doesn't affect children. Those who say that either have their head 10 feet deep in the sand or are blatantly lying about the data. You can decide which one applies to Claire. In the real world, US data show that 202 children in the age group 6 months to 4 years old died of COVID-19. This represents 1.7% of all deaths in this age group. That's pretty significant. That's about 10 times as many children as who lost their lives in Uvalde last month. And that's not even counting how many children are hospitalized, suffering from multisystem inflammatory syndrome, and the over 200 deaths in the age group of below 6 months of age. As long as these age groups go unvaccinated, they will be vulnerable, and they will be left behind the rest of the population that has vaccines available to them. And included in these age groups are extra vulnerable children, the ones with cancers, the ones with underlying health conditions that they were born with, the ones who are otherwise immune suppressed. They deserve protection too. They don't deserve to have people like anti-vaxxers advocating against their safety online. That is just ridiculous.
Now, originally, these products were sold as actually also reducing transmission. Now, it would be completely unethical to use young children as a human shield, but we now know that they don't reduce transmission. The WHO have stopped claiming and they reduce transmission, so that argument doesn't apply either.
No, vaccines absolutely reduce transmission. It's not 100% by any means, but it does reduce transmission. Combine that with other transmission prevention methods such as masking and testing yourself and being extra careful if you think you're positive, that can all have a big impact too, so don't stop doing those things. But yes, vaccination does reduce transmission. We can see this demonstrated through experiments such as these, which actually measured the amounts of infectious virus that COVID-19 patients were shedding, whether or not they were vaccinated or unvaccinated. And these results consistently showed that vaccinated people shed less virus. And this makes perfect sense because their immune systems are primed to react and clear the virus faster than an individual who has not been vaccinated and their immune system does not know what the virus looks like. I don't understand what she is saying by using children as a human shield. This is all to protect children, because when sick children are around other sick children, they can also spread diseases amongst each other. And the spread of infectious disease, the greater it is, the more hospitalization, the more death, the more suffering you will have. This is all to protect children, Claire. Please understand that. Please read. It'll really help you out.
Parents should be demanding that the decision makers explain themselves.
How about as a parent, I demand that you read the document that you claim to understand, Claire, before you go online and needlessly scare parents into putting their kids into a riskier situation than is necessary. Well, Claire didn't seem to read the document, but you can do that for yourself. I've linked it in the description along with all of the other science that I've talked about in this video so that you can read up on all of the data pertaining to COVID vaccines and your kids so that you can actually make an informed decision and get your kid vaccinated. Well, that's going to do it for this week's video. In case you haven't noticed, I did recently start a Patreon finally on this channel after 2.5 years of doing it for completely nothing. So if you want to check that out, the link is in the description. Otherwise, thank you so much for watching, I really do appreciate it, and don't forget to subscribe so you can catch me next week, where I'll be debunking some more funky stuff. See you then.